Okay, good evening, everyone. It's Jennifer Cornell here, Director of Long-Term Care for the County of Grey. Wanted to bring you an update. Apologies for the last-minute change in the format, but we wanted to make sure that you had an update for today, and we will do the live Q&A on Monday and look forward to talking to you then. So I'm going to just share some of the information that has come to light in the last few days. On December 14th, the Associate Deputy Minister of Long-Term Care released a memo that outlined temporary enhanced measures due to the increase in COVID-19 cases as a result of the new variant, Omicron. Effective today, all general visitors must be fully vaccinated or have a valid medical exemption to visit indoors at all long-term care homes in the province. There's a maximum of 2 people, DCPs and visitors, per resident to visit at one time. Outdoor visits can occur regardless of the vaccination status with a maximum of 4 people, that would be DCPs and visitors, per resident visit. Unfortunately, children aged 1 to 5 are not permitted to visit indoors, but are able to visit outdoors if screened and tested. And that's related to their eligibility or ineligibility for vaccination. In addition, effective December 17th, but already in progress in our 3 homes, all staff, students, volunteers, and designated care partners must undergo surveillance testing every other day. So that's rapid testing every other day. All general visitors and support workers must be tested each time they attend a home unless they have a negative test from the previous day. All current designated care partners must provide proof of a first dose of vaccine or a valid medical exemption by December 20th to enter a home, unless they are visiting a resident receiving end-of-life care. These designated care partners will have until February 21st to be fully vaccinated, which is 2 doses of vaccine. And until fully vaccinated, DCPs with 1 dose will be limited to visiting their loved one in their room. A maximum of 2 caregivers can be designated by a resident, and any newly designated caregivers must be fully vaccinated to enter the home. So if anyone who moves in to one of our 3 homes after December 15th can designate 2 designated care partners, but they must be fully vaccinated in order to be a DCP. If a resident currently who's been living in the long-term care home has more than 2 designated caregivers, that does not have to change. Residents who are fully vaccinated may continue to leave the home for day absences and must be reminded of public health safety measures to follow when you're outside of the home. They will be required to be screened and tested after the day absence as outlined by the directive. And in a moment, I'm going to share a summary snapshot that we will also circulate with this call. Social and overnight absences are being suspended due to the increased transmissibility of the Omicron variant. All residents may continue to leave the home for essential, medical, or compassionate reasons. No large group activities are permitted, and residents should be cohorted for higher risk activities like singing and dancing. So for example, there still can be carol singing activities within the home, but must be cohorted to the resident home area. With respect to dining, fully vaccinated caregivers may continue to join residents for communal dining or family-style meals. Unfortunately, they are not able to eat with the resident, and they must remain wearing their mask at all times. We really appreciate your cooperation with these enhanced measures, and we encourage you to please get your 3rd booster dose as soon as you're eligible. It really does provide an extra layer of protection. And I'm just going to share my screen so that you can see the snapshot. Okay, and so we will circulate this around with this video as well so that you can see it. And, oh, there we go. It wasn't allowing me to minimize it. So this is just a summary sheet, a one-page summary of these changes, because there are a lot of changes and it's a lot to take in. So we talk about visiting, whether masks are required, is there a different requirement whether you're fully immunized or partially immunized, and does that change if in fact the resident is in isolation for suspected respiratory illness or COVID, or if the home is an outbreak. I'll scroll down to absences. So again, all medical, compassionate, and essential absences continue to be permitted. Short term, so a day trip, is permitted for fully vaccinated residents. And overnight absences are not permitted, and off-site group excursions are not permitted. And just to kind of reiterate what happens when someone goes out on a day trip. They go out on a day trip, that's day one. When they return, they're not required to be isolated, but they are required to have a rapid test and a PCR test on day 3, and then again on day 7. So for every day trip, they're required to do that. We are sorting out, we asked the ministry what would happen for someone who goes out on day 1. They have their rapid test on and PCR on day 3, but they also went out on a day trip on day 2 and day 5. What process happens then in terms of testing? And the Ministry of Long-Term Care assured us that they are putting together a frequently asked questions document and will address that question in that document. So as soon as we get that, we'll pass that on. Social gatherings continue to be permitted, but with additional restrictions. So really supporting physical distancing, cohorting the residents from their own home area. Recommendations are for a maximum group of 10 people. And we do continue to support residents in wearing a face mask if they're able to tolerate it. Just stop sharing. We've also updated the visiting guideline tool because, again, it's that chart that shows all of the different rules and requirements and also opportunities. So we continue to have opportunities to schedule window visits, indoor visits, outdoor visits, and virtual visits. The booking tool and the website have been updated to support that. And so you can go to the Long-Term Care Homes website and start scheduling those bookings. Additionally, the last time we talked, there was lots of questions about booking rooms to have Christmas and holiday gatherings in the home. Anyone who has booked a room has been contacted by a team member from the home to talk about what your options are. We must still follow these restrictions, so we can still do small gatherings, but we need to stay within the limits that have been outlined and follow the testing guidelines and the screening guidelines. We are actively working on creating as many opportunities for vaccination clinics at each home as we can to support third doses for staff and DCPs, and also opportunities for anybody, any staff, volunteers, and designated care partners who may need their first or second dose of vaccine. We know these changes have a significant impact on all of your plans over the coming days. We're committed to doing all that we can to be safe and still find space and time for the joy of the holidays. The teams in the homes have many activities and celebrations planned, and they aren't canceled. They're just adapted. So please review the documents that accompany this email. If you have questions, feel free to send them to us ahead or attend the meeting on Monday, and we will answer all the questions as best that we can. And for any of you that are not planning to join on Monday, I will just close by saying the coming days may not be easy, but we do have the tools that we need to keep each other safe. We can also find ways to show our love and support that don't necessarily need us to be in the same room together. While it's not what we imagined for this Christmas, we will make the best of things. So please take care of yourself, be safe, and seek out joy. Thank you.